Keely McDowell is a 45-year-old mom from Des Moines to a loving daughter and their loving dog, Dilfer. She's also a cervical cancer survivor and wants other women to know what she wished she knew when she was younger.
I had been ignoring a lot of signs that I should probably go to the doctor about this. I had basically had a period for 2 years.
But she didn't get her abnormal bleeding checked.
Things were more important, my daughter being a single mom, all that kind of stuff. So I started feeling some pain in my stomach, and I went to the urgent care and I was like, oh, I think I have like maybe a UTI.
But that wasn't the case. When her bleeding got worse one night, she went to the ER and later discovered she had stage 3 cervical cancer.
As soon as she said cancer, my mom and I just kind of looked at each other like, did she really just say that?
Keely is among the 11,500 women who are diagnosed with cervical cancer every year in the U.S. She was 39, going on 40 at the time of her diagnosis, the exact age group that in recent years has seen a slight rise in cervical cancer cases in the U.S. Data from the American Cancer Society shows cervical cancer among women ages 30 to 44 have increased 1.7% each year from 2012 to 2019.
With cervical cancer, there is actually two peaks, and one of them could be in the later 30s, early 40s, and another one is after age 60.
Dr. Tracy Flum is a medical OBGYN at Virginia Mason Franciscan Health. She points to the effectiveness of the HPV vaccine that has led to lower incidence of cervical cancer among younger women who got the vaccine when they were adolescents or even younger. HPV is the viral infection that can cause cancerous growth in cervical cells. But for women who miss the window of getting the HPV vaccine prior to being sexually active, Dr. Flum stresses the importance of those annual checkups.
So if you go 5 years missing your pap smears and missing your surveillance, that's a window where we might have been able to identify you as a higher risk person for developing precancerous cells of the cervix.
Keely is among the women who missed the chance to get the HPV vaccine while she was adolescent age, as the vaccine known as Gardasil was FDA approved in 2006. Later on, the busy working mom did not go on those regular checkups.
I always put it off. I never thought that anything was wrong because nothing really, like for me, if something's wrong, something has to hurt, right? Or something has to be weird.
Precancerous lesions don't have any signs and symptoms. They are completely asymptomatic. So that is why screening is so important.
Keely says she learned the hard way.
Everything else kind of took priority over my own health. So I just tended to ignore.
Upon her diagnosis, Keely immediately started radiation and chemotherapy. Doctors told her she had a 50-50 chance to beat this.
The doctors at Virginia Mason that I got to work with were so positive, and they were like, this is one of the things that we know that we can treat, that we can do aggressively.
And she did beat it. She's now been in remission for about a year. Keely now hopes other women will listen to her story and to make their health a priority.
I am the cautionary tale because I didn't go in for annual screenings, because I didn't think about anything else. Like, I had to go through this myself, and the people that I care about and the people that I talk to, I don't want them to have to go through that again.
For HealthLink, I'm Christine Pei reporting.